This segment is sponsored by Fairfax Radiology. Heart disease typically progresses slowly for many years, and if you're at risk, it's really important to find out early when coronary disease is easier to treat.
Coronary CTA is an advanced screening and diagnostic test that uses sophisticated x-rays to help detect early coronary disease, and Fairfax Radiology is the most experienced site in the region that offers this procedure. So joining us today to tell us more about this is Dr. Melanie Atkins from Fairfax Radiology. Good to have you.
Thank you very much for having me.
Thanks for being here to talk about this. What is the value of a coronary CTA? What is it?
So a coronary CTA is really a fast, easy, low radiation CT scan where we look at the heart, all of the structure of the heart, and then also look at the coronary arteries. And so the value of that is we can see areas of plaque, we can see areas of stenoses, and then we can see other problems that are going on with the structure of the heart.
Right. Well, with heart disease being the #1 reason for death in the United States, how can a coronary CTA help with this?
So this is a great question. In 2023, it's still, for men and women, still the #1 cause of death. So it's really important that we try to identify those patients that are at risk for having a heart attack early on. And so with coronary CTA, we can identify the areas of plaque, whether it's the calcified plaque that we think is more stable or the non-calcified plaque that tends to cause more problems, and get those patients on adequate medical therapy. So patients who have a family history of coronary artery disease or have risk factors such as diabetes or hypertension, we want to identify those patients who are at risk and get them on accurate medical therapy, and all of that can be done with a coronary CT.
And that's non-invasive, it's just a scan, right? Like a CT scan that we know of.
Exactly. So when the patients come to our office, we will bring them into the room. Occasionally, if their heart rates are very fast, we give a small beta blocker, which brings your heart rate down a little bit. The entire scan is done in a single heartbeat, so we like to have the heart rate a little bit slower, so we have that a little bit of extra time. So we'll put the patient on the table, we put EKG leads on your chest, and then we put them through the CT scanner, and it's all done in a matter of minutes. The scan itself is less than a second.
Oh,
it's
wow.
amazing how far we've come to be able to help people in this non-invasive, kind of quick and easy way. You kind of touched upon it, but is anyone eligible for this, or again, it's just certain people?
So with modern technology that we have today, really all patients are eligible. When we started doing coronary CTA years ago, we had trouble with patients with arrhythmias or faster heart rates. And today we can, with the way the technology is, we can really scan everyone. We do give a small contrast dose, so patients who have a severe contrast allergy may want to consider another test, but otherwise this is really the recommended test for identification of coronary disease for all comers, for all patients.
Okay, so the question is, Melanie, does insurance cover this?
Insurance does cover
this.
Yes,
Good
yes.
news.
It has been a struggle over the years to really get it covered across the board, but Medicare and all major insurance companies cover this, and it's really in the new chest pain guidelines that came out from the American College of Cardiology in 2021 recommend this as the first-line test to evaluate for chest pain.
Makes sense. I mean, it's a simple test that could really save a lot of,
it's
lack of a better
relatively
term, heartache
inexpensive
down the road, right?
Compared to other exams, and it's non-invasive, so it can avoid having an unnecessary heart catheterization.
Right. You mentioned other exams. There's something called a stress test. How is this different?
So this is different. A stress test, either you exercise on a treadmill or we give you a medication to help your heart feel like it's exercising, and then we look at how the heart is functioning and whether we think there is going to be some sort of blockage based on how the heart is pumping. But you don't get the actual anatomy, and you don't see if there's coronary disease. We're just making an assumption. So this is really an anatomic difference. We're really able to see all of the areas of plaque and stenosis and send that to our cardiologist to get them on adequate therapy, and then we can follow that down the road and see if the medication's helping, see, you know, a couple of years from now, are they getting improvements? Is their therapy working?
Yeah. Dr. Atkins.
Amazing.
Yeah. Thank you for really explaining it and breaking it down. This is great information.
Fantastic. Thank you for having me.
Thank you. For more information, go to fairfaxradiology.com.